welcome back to EANM TV. My name is Roy Shepherd. I hope you've had a good day. A lot of very tired faces around the exhibition and the Congress halls today. To bring today's broadcast to a close, I've been joined by Michael Lassman, who's a medical physicist at University Hospital in Würzburg and a former member of the EANM board. We also have Wim Oyen, who everybody knows is a former president of EANM, and also with Christophe Deroose. And we're going to be talking about a subject which, on the face of it, and I don't want to be rude when I say this, but about policy and regulation. And a lot of people go, oh, that's so dull, that's so boring. But it's really not. This is something that is fundamentally important to nuclear medicine, and we're going to explore that now. But Christophe, can we start with you? And can you just tell me a little bit about what Erasmus and the RLT Academy project is, and how that fits within all of the other work that's going on?
Okay, so RLT is a novel treatment modality that consists of the injection of radiopharmaceuticals that are typically systemically administered and that will home into a molecular target present on the tumor cells.
So it's really targeted. I mean,
yes.
You say it's novel. I would say it's hugely innovative.
It is disruptively innovative, for sure. And actually, the concept itself is not that recent. It's going on for decades. But what is driving it is that we currently have many new targets for which radiopharmaceuticals are being developed, and so that we can expand actually the reach of these radioligand therapies. We have a number of them that have come into full market access, for which evidence has been generated. They are now endorsed by guidelines and reimbursed in many European countries, such as ligands for neuroendocrine tumors and prostate cancer. And the thing is, and that's why the RLT Academy comes in, is that the nuclear medicine field now is having to treat much more patients than we historically had to do. And
or you're able to treat more than you were historically able to.
Yes. So now we have new indications, we have new settings, and for that we need to increase our skills and increase our workforce, and we need to learn our colleagues that have not been exposed to these RLT treatments on how to do this. And the RLT Academy was actually a European project funded by the Erasmus Plus project that focused on training in radioligand therapies, consisting of both the setting up of an entire curriculum, which is on our website, rltacademy.eu, and it's free for use. And you can learn about all the basics about RLT, from radiobiology and fundamentals, up to the way of doing the treatment and practicalities like taking informed consent of a patient. Everything is on there. That is one aspect of the RLT Academy, and the other one is really focusing on the policy and regulations that you were talking about, is the fact that we have set out policy recommendations to increase the adoption of RLT in Europe, both existing therapies and novel ones.
I mean, this is particularly interesting because there's a conflict here, isn't there? That you are at the leading edge of the technologies and therapies, whereas the EU government has a responsibility for patients, so they can't be seen to allow patients to become guinea pigs, if you like. So they're very often seen as being very cautious, or some people would say over-cautious. So how do you draw the line? How do you get the EU involved so that they trust that you guys actually know what you're doing?
Yeah, so what we actually did is we had a whole set of experts in the field that have been interrogating the fields, going to meetings, going at workshops and reflection boards. And then they formulated recommendations on how we can actually increase this process. And it goes from many different angles, from waste management to how do you design clinical trials, to what pathways do you have to develop theranostic imaging, because we typically want to assess the presence of the target with a diagnostic scan before we do treatment, but there's no framework for this in the current regulations. And we have given them, we as experts in the field, have given the advice, this is what you should do so that we can increase the adoption of these novel therapies.
All right, Wim, you've had a lot of experience and you work with government in your proper job as well as your role, within EANM. What is the relationship like between the EU and nuclear medicine, and in particular EANM?
Yeah, Well, we started this when I was in the board of EANM several years ago, and we realized that it is of the utmost importance that we have a dialogue and with our regulators, as well as an influence. EANM was many years ago at the receiving end of regulations and directives. And as a board, we realized that we need to be more proactive. So after my presidency finished, I kept being involved in the EU policy work. And let's say from scratch, EANM built an internal organization with a committee, now a council, that does policy and regulatory affairs. We have excellent support in the EANM office by two EU policy officers, Amélie and Moritz, and now Javier has joined. So we're getting quite some substance within EANM to become more proactive in our dialogue with our regulators, because whether we like it or not, let's say our regulators will have an opinion on both the pharmaceutical as well as the radiation.
Absolutely, yeah.
And will put out guidance, but also laws that we have to adhere to.
So who do they listen to then? Do they listen to industry more than they listen to the practitioners, or what's the balance?
Let's say there is certainly a balance. Let's say first and foremost, they listen to the patients. But
I forgot about them.
Yeah, but they also listen to us as professionals, and they listen to our opinion. But first of all, they have to know that you're there and that you're willing to communicate. And that's what we've been doing for the past couple of years, is raising the awareness that there is a lot of knowledge in the field for the good of our patients, and that we want to work with our regulators to safely use these therapies and expand these therapies and make them accessible to the patients, and not the other way around, that we are over-regulated, that is restricting patients to take benefit from our therapies.
I mean, the other side of this then is the availability of isotopes. There was a shortage, I seem to remember, a few years ago. But there are also massive regulatory issues around that. How is that currently being dealt with? Where are you at with that?
Yeah. So EANM has been traditionally very much involved in the dialogue with industry on the production of medical isotopes.
And the transportation of.
And the transportation. And let's say, fortunately, a big chunk of world production of medical isotopes is actually in the EU, let's say with major producers in the Netherlands and in Belgium, but also production in Poland and in France. And so we have a good infrastructure, and with new investments kicking in, with new reactors being built as we speak, we hope that we are managing the relative shortages at the moment, but that in a couple of years we will be remembering it as a bad dream, and that we have enough nuclides to work with.
So the issue is quite acute, I seem to recall, 3-4 years ago. So would you say it's better now?
It is better, but I'd say for the therapeutic isotopes, I think for the ones that we use in regular clinical practice, it's okay. For experimental therapeutic radionuclides, there is still a shortage, and we still can't get enough to do the clinical trials as we want to run them. But slowly we see the interest of industry to make the availability better, to also look into novel isotopes, so we get a choice that we can tailor the treatment also on the basis of the characteristics of the therapeutic radionuclides that we have. So it's getting better. We're not there yet. Will
you ever be?
Well, at the moment we have again a shortage of technetium 99M. So we're not there, and we're still worried. But we are very confident that with all the investments that are going on, that we will end up in a solution for Europe, but globally, that we have enough.
Right, Michael, if I can bring you in, what work is being done on the safety aspects and the way that industry is actually becoming more integrated as part of this problem and solution?
Yeah, okay. So we have some projects, tenders taken out by the EU, and just to address these aspects. And for one of the tenders that we were adhering to...
Can you speak up a little bit?
Yeah,
I'm struggling here.
Sorry. For the tender that we are adhering to, that was the SIMPLERAD tender, was dealing with the special aspect of radiopharmaceutical therapies and the reconciliation between pharma legislation and radiation protection legislation, because this was an underdeveloped field at that time. And so for this project we just gathered experts from radiopharmaceuticals, from medical physicists, medical doctors, and to try to reconcile these requirements between the pharma legislation and the
I mean, it sounds like an impossible thing to create comprehensive guidelines for something that hasn't really happened yet.
Yeah, but there are also treatments which are licensed by the European medicines agencies, and also we looked at these and how to better reconcile the already existing therapies. Another aspect, of course, is what's ongoing with clinical trials, and there are also some developments and discussions within the project how to set up clinical trials in future to reconcile the requirements of the two different sets of legislation in Europe. And for this also we have different players. We have DG Santé on the one hand side, we have DG Energy, two commissions, and EMA as a third player. And yeah, it's an interesting...
Did you get on well?
Yes, during the project, I think we achieved a lot during the project. People were thinking about how to do that, and also now there's a working group at EMA especially looking at requirements for clinical oncology with radiopharmaceuticals.
I found it, working in many different sectors, that collaboration looks great on paper or on an Excel spreadsheet, but the reality of it is sometimes very difficult. Is collaboration starting to happen now because people understand that it's actually so much easier rather than people trying to protect their own short-term self-interest, perhaps?
Good question.
Usually when people say that, they don't know the answer.
Yeah, that is a very good question. I think during the project we achieved a lot of interaction between the different players in the field, in particular also within regulators, because if you underestimate the power of the regulators, just looking at the drugs at a local, at the different countries, and also the interpretation of the European legislation within different countries is very different.
That's the other issue, isn't it? Yes.
So it's very difficult to get these on board, but at least we stimulated the discussion. We had good discussions, and people try to collaborate now much better than they did before. But on a long run, we will see what comes out of it.
I mean, doesn't that really boil down to the basics of it's all about building trusting relationships, and people realize that, you know, you are really trying to work together in order to achieve something. Tell us about SIMPLERAD.
Yeah, SIMPLERAD was a tender taken out by the EU. We teamed up with the European Federation of Organizations of Medical Physics and with ABIR. And that was a 2-year tender, just looking at a particular aspect of legislation, of pharma legislation versus BSSD, Basic Safety Standards of the European Commission. How much dosimetry is needed for treatment? That boils down to the question. But not only, there were other questions addressed like waste management, shortage of staff, which is also
the entire supply chain.
Yeah. Everything was covered.
A difficult question, but maybe we can sort of bring this discussion to a close. But where do you see this all heading? So just imagine, I've asked this question many times, it's 3 years' time. What would you hope to have achieved? And I'll ask you as well.
Yeah, for me it would be good to reconcile the requirements of the BSSD, having this done in a manner throughout Europe that is uniform, so to speak, and that also helps to get everybody in Europe, every country, to get the same treatment, not having different treatments in different countries because of accessibility.
What would you add to that, Wim?
Well, I think one of the important aspects is trust. Let's say what I want to achieve also in the Policy Regulatory Affairs Council is that EANM becomes, let's say, the trusted partner.
Or more trusted, because you are trusted.
We
now,
are trusted, but
yeah.
let's say we want to be the partner for the EU gremia to turn to when something with medical isotopes pops up, that we are a reliable source of information and expertise. Let's say the concept that the regulators are out there to make our life difficult and are out to get us is not correct. Let's say we want to move from reacting to what has been thought about and written down to being proactive and be part of the dialogue. And let's say Michael and I are a member of an EMA committee that is actually working on that. And you see that once you're within that gremium, that, let's say, the people there are very receptive, and they're also knowledgeable about their part of the equation, the rules and regulations, but we are the experts on the content and they accept it. So it's about trust, it's about dialogue, and it's about breaking down artificial barriers between the regulators and the field.
So a good strategic decision made by EANM a number of years ago.
Definitely.
Christophe, final words, do you want to add anything?
Yes, so I think with the RLT Academy, we have a great repository on knowledge. It's over 30 hours of videos where you can look at the entire field and learn about it. So it's free for everybody to use. I think that's a great achievement of our project. We also trained 40 people on site. We are looking at how we can continue these kind of trainings. But the most important I'd like to say is that our policy recommendations that we made to help with the adoption of radioligand therapy, I hope that will be followed by the different players within the field. And I fully agree with Wim that we need this kind of trust, and EANM is the de facto partner for these policy issues. And the final word about RLT maybe is that as we speak, roughly 50%, 1 out of 2 cancer patients in their lifetime will be treated with radiation treatment, external beam, not what we have been talking about. I think that within 10 years' time, we could do more patients with treatment, with radionuclide treatments, than we could do with external beam. That's one of my colleagues, Andreas Kerr, who has once told me this. And he might be right, might be wrong, might be right, but nevertheless, we will have treatments for a huge amount of cancer patients at one stage of their disease. And it's very important that the regulations and the rules that we have do not hamper the development of this field. This is very important, and let's keep working on this.
What a great way to end this session. Thank you very much indeed, gentlemen. Enjoy your evening off, and for those of you who've had many sessions you've attended to today, I hope you get some relaxation time this evening. That's all from EANM TV from right now. Bye-bye.